All right. Yeah, we're back. We're checking in with Dr. Aseem. How's it going?
It's good, man. It's good. Just trying to get through lockdown like everybody else and trying to follow my own advice in terms of how to keep mentally and physically well.
Yeah, that's good. You just went for a walk with your dad.
Yeah, just went for a walk out with him, our daily walk. I've got an exercise bike at home. I'm doing body lifting and free weights with a kettlebell. Normally I'm used to going to the gym regularly. I can't do that anymore, so I just got to improvise.
Exactly. Yeah. I've been saying from day one, get the vitamin D, get in the sun, stay active. This is all what we need to be talking about. And it's so great that you're on this big platform over in the UK and you somehow made it into the mainstream media, which is great because not a lot of our community has. So tell us what's been going on and what kind of interviews you've been doing. And
Yeah, Brian.
yeah.
So I think, at the end of the day, I use a quote from, and I hope I'm not inappropriately using this quote, but when I was in LA when we met, I remember seeing a billboard, a quote from Harvey Milk, the LGBT activist, and he said that rights are only won by those who make their voices heard. Hope is never silent. And in this advocacy, in this campaign, this movement we're all in, if there's an opportunity or a chance that we need to, talk about, then that really is highlighting a gross injustice which is being committed on millions of people around the world around the dietary advice they're getting, the fact that the food environment doesn't encourage healthy eating. When I was looking at the whole COVID stuff that was coming out of China and Italy, it became quite clear looking at that data early on that there was an increase in mortality in people who had chronic metabolic disease, diabetes, hypertension, and obesity seem to also be emerging. In Italy, for example, the average age of death was 81. So certainly we know age is a big risk factor, but only 0.9% of those people that died had no underlying condition, i.e. no metabolic disease going on. So I think that was a very crucial piece of information that I felt needed to be discussed in an open way, not just to highlight the fact that this was clearly an increase in mortality in people with diet-related disease in effect, but also the fact that we know, Brian, and people in our community know that you can improve these risk factors, even send many of these conditions like type 2 diabetes and put them into remission within weeks of changing diet. So given the fact that this is an ongoing problem and it was about to hit the UK, I then initially wrote an article in the Sunday Express newspaper, having spoken to them. And I contacted people that I know at Sky News and said, this is, I've written this article, it's been accepted for publication. Would you be interested in discussing this? So the first thing I did, which was about over 6 weeks ago now, was say the elephant in the room is chronic metabolic disease. It seems to be a big risk factor for death. And of course, there were other publications coming out in the medical literature, which also suggested that, for example, with type 2 diabetes and metabolic syndrome, there may well be a tenfold increased risk in mortality from COVID. So putting it all together, I then wrote another piece, a stronger piece, in European Scientist, which became I think it broke their record for the most number of views of an article. I think it's already 250,000 views. That was the next stage, and then just kept, escalating from there. I think one of the things that got the immediate attention here was the fact that our Prime Minister, Boris Johnson, also unfortunately, suffered a complication in the sense that he got admitted to the hospital and he was very sick for a while from COVID. But one thing I observed and noticed was the fact that he is clearly overweight, yet the rest of the cabinet, or certainly senior members of his cabinet in the government who got COVID-19, who are clearly very slim people, did not get adversely affected to the way he did. And we know from influenza data that people with obesity have a much more increased risk of hospitalization. They shed the virus for longer and they have a greater risk of complications. So that was something that I observed, and I mentioned it was an observation, but certainly seemed to fit with the evidence. In an article I wrote in the Telegraph newspaper, and the next thing that happened was the whole of the British media seemed to just suddenly jump on it. I was on Good Morning Britain, BBC News International, and then it just took off from there, really.
Yeah, that's so great that they have picked up the story. And how did those interviews go? I know those were last week, and I just want to know how they're accepting this, because it seems
Very
against this
well
popular
received,
opinion.
actually, Ryan, because the evidence is, it's been, there's not been, certainly with the media, there hasn't been anyone that, I think they're open to listening to what I have to say, but I put it in the context of the bigger picture that one of the reasons that we've had this lockdown, one of the reasons that we've had to suffer through this as badly as we have is because the general health of the British and American populations, I know that you've had it pretty bad in the States as well, is the general health is pretty dire. The baseline general health to start with was in a bad state. Less than 1 in 8 Americans are metabolically healthy. So I think the facts speak for themselves. And I think the only thing that people aren't aware of is the fact, that these, dietary changes can have a significant impact in a short space of time. And most of that is lack of knowledge, Brian. I mean, there's a very interesting recent publication in the BMJ Nutrition Journal that revealed that more than 70% of junior doctors felt they had lack of knowledge when it comes to nutrition. They thought it was extremely important, but they had lack of knowledge, lack of time, and didn't have any confidence in discussing it with their patients. So in other words, there is a huge issue, a huge gap, if you like, which again needs to be discussed openly amongst the public about doctors' understanding of nutrition, and certainly in relation to management of chronic disease. And it's not pointing the finger at them, it's just something we're not trained to do. And until we highlight it, until the public are aware of it, it's another barrier in making progress to tackling this problem.
Yeah, that's so huge. I mean, I guess that's why I'm making the film, right? It's that it's not that people don't lack effort or willpower to make changes. They have the wrong information, and the doctors have the wrong information. And yeah, so many people, I wish doctors could just know that, we have new science on ways to reverse type 2 diabetes, for example. And that.
Absolutely, Brian. And this is what I do in my clinical practice all the time. And I see those results and they're remarkable. So it's important that we just share that knowledge and use every opportunity we can to at least highlight it and get it into the mainstream media, because ultimately that's what has the biggest impact really on the policymakers. That's what really gets many more views and eyes on the issue. And of course, we have a huge groundswell, social movement going on in this space with low carb, for example. But the biggest impact is going to happen when you have government, intervening and also adopting, and mainstream media, if anything, more than anything else. From what I understand, there hasn't been that much sort of broadcast media coverage of this in the United States. I've seen some articles. I know Mark Hyman and Darius Mozaffarian wrote a very good article in Boston Globe a few days ago. So I've seen some bits and bobs here and there about the diet component specifically being something that needs to be addressed, but I'm not aware if there's been much coverage in the United States on this, certainly in the mainstream media and in the newspapers.
No, not at all. I mean, I didn't even know about that article. And all the articles I've seen are about getting donuts and free McDonald's for the workers and how you should be eating comfort foods and that type of thing.
Yeah, that's very unfortunate. But again, it's either these are profit-making businesses and they're taking advantage of the situation. But unfortunately, these are not the kind of foods people really should be eating right now during this epidemic and this pandemic. And as you're aware, one of the issues in the UK, and I don't know if you've got data in the United States, but more than 50% of our National Health Service workers are overweight or obese. 1 in 4 nurses are obese, actually have a BMI of over 30. So actually, they're already at risk, and therefore endorsing, promoting, being sort of joyous in a very public way about all this free junk food isn't really sending the right message at this time.
Yeah, it's tough. My good friend is a nurse here in LA, and I did a little live stream with her. And I mean, she tells me all the time that all of her coworkers are very overweight and they're all very scared of this. She's very slim and is not really that worried because she understands, that she has her own health in her hands. And that should be the takeaway message, is people can take health into their own hands, like we've been saying. But when it goes to immune system, you mentioned the flu, obese people are more at risk. I think this is super important to highlight because I only get sick. I mean, I haven't been sick in about 4 years. And the only time I almost got sick was because I ran down my immune system. So I think people need to understand that it's not that there's this germ going around. There's always germs going around. There's always viruses going around. It's you. You need to take control of your health. And that's when you get sick. People I know who get sick, they get sick after they go on a trip and they don't sleep and they eat poorly and they, do any number of things. Then they get sick. Is this magic that the flu just came around right then? Or is it because they ran down their immune system or weren't eating well or just aren't healthy in general?
Absolutely agree. It's multifactorial, the diet and the sleep, the stress. not overtraining, when you're traveling, eating bad food, all these things I'm sure all play into your vulnerability from infection. Absolutely. There's no doubt about it. I think to be fair about the personal responsibility side, I think there is an opportunity for people to take things into their own hands. But to do that, you also need the knowledge, you need access, you need affordability, and you
Mm.
need choice. And unfortunately for many Americans, Brian, that just isn't the case. There are many people who have, who can afford decent, healthy food, have easy access, etc. But people from very poor backgrounds, people who are struggling to make two ends meet, people who have job insecurity, we need to really help and create an environment so that for them, the healthy choice becomes the easy choice and the affordable choice. And that can only happen, Brian, with government intervention. I know in the United States there's this big thing about nanny state and freedom of choice and stuff like that, but we have to define what that means. We've got to think about how do we look after those people who are the most vulnerable in society, because we're all interconnected. I think one thing that COVID-19 has revealed is that we all actually need to survive. We all need each other to survive, even individually. The people that run our public transport systems, the people that run the healthcare systems, the people that take the garbage out. These are all people that, unfortunately, a lot of these people come from vulnerable backgrounds. So we need to make sure that we're doing our bit to encourage and ensure they have the best chance of good health as possible, because an unhealthy population is also an economically unproductive one, and it's an unhappy one too.
That's a really good point. Yeah, sometimes I get lost in our little community and everyone is taking control of their health and we have good information and maybe we do have more money to make it happen. So yeah, it needs to start from the top. Yeah, I mean, both sides, right? It's like people
Absolutely.
do it from the bottom, but you're right. There's so many nursing homes and, different facilities that the dietary guidelines and all this stuff matters, and the food that they have there. Last time we talked about the hospitals and how they had junk food in the
Yeah.
hospitals.
Exactly.
So
So we need to just think about how do we make the default choice a healthy choice. So we get the information right. We empower people. Of course, education is crucial, but actually it's only going to work and sustain itself if the environment around us is conducive to it too. So we kind of want to help people, swim with the current as opposed to swimming against the tide, which is a lot of what we're doing these days. And of course, no socioeconomic group is immune to it. The whole issue of obesity. There are people who come from wealthy backgrounds, of course, as you probably know, who are still affected by this issue of diet-related disease, because it's just the addictiveness of ultra-processed foods, the culture we live in, the way we the way people work, the amount of time we dedicate to eating, all of that has been sort of diminished over time. And I think that the statistics in the UK is that the average Brit spends something like 10 minutes having their lunch. The traditional kind of European societies and Mediterranean countries, traditionally, there's always an hour taken out for lunch to eat your food, enjoy it, socialize, etc. So I think we have to think also moving forward about changing the way we live, Brian. There is some good data even about being productive in work, that actually you're not any more productive after doing more than 36 hours a week. So can we change the way that we're doing stuff, and keep as productive, but have a bit more time to ourselves to do things that are going to be conducive for our physical and mental health?
I love that. Work harder, not smarter, or work smarter, not harder. Right? I'm all about
Yeah,
efficiency.
let's advocate for a 3-day weekend.
Yeah.
Why do we have to work on Fridays?
If you're efficient, I think, no, I'm serious. A lot of people are inefficient because, they have these 40-hour work weeks. Some people brag about working 60 hours a week. And I don't think that you're that effective. And there are studies to prove it. So I'm always on
Absolutely.
this
I mean,
mindset.
yeah, absolutely. I mean, as a junior doctor, before there was what's something called the European Working Time Directive, which made it a legal requirement that on average over a number of months, you couldn't work more than 48 hours a week in the UK. I mean, I started off working, I was working 90, 96 hours a week, and intense work, and it's not
Mhm.
healthy. It hardened me up, and but it's not healthy, and you're certainly not going to maximize your ability to help patients, certainly in a difficult situation when you're having to manage lots of patients, people are getting sick, and you've got to think very quickly on your feet in terms of what could be going wrong with somebody, how quickly can you institute treatment. Doctors working that many hours is actually putting patients at risk as well.
Yeah. It's I think everything's kind of comes down to efficiency. We talk about nutrition. It's eat nutrient dense foods. If that's an efficient way of eating, you don't want excess carbs or excess sugars or excess fat even. And then even exercising, I think you should work out efficiently. And it's same, do weights and do sprints and stuff like that.
Yeah, and even in terms of, there's good data showing that actually if you're healthier, organizations where have healthier employees actually have better outcomes in terms of their performance. So, think about this as well. It's just an observation. It's not, again, fat shaming and pointing fingers, because, I have relatives, friends, people, loved ones who all are suffering from weight issues. But look at, the police, the fire service, the military, and you look around, just observe how many of these people are in the best shape they could be for their jobs. And you'll find that it's probably a minority. It's probably a small minority. So these people are not even able to function in their jobs optimally because of weight issues. And I think it was US Surgeon General a few years ago said that the obesity epidemic is now a threat to national security in the United States. Why is no one talking about that?
Wow. Yeah, that's going to get serious once it's the threat of our, whole nation. So how do we make this message? You're doing your work to make this message when it comes to the end of this, is that it's more about being healthy than anything else, maybe, that they're trying to push. I don't know if that's, maybe I don't want to say it's the most important message, but how do we get that this takeaway from this is that we need to focus on our health?
Yeah, I think there needs to be a cultural shift as well. There needs to be more empowerment and knowledge. There needs to be policy changes. There needs to be people at the top of government saying this is a really serious issue that needs to be dealt with. We have to really combat this because, I think with this pandemic, we literally have, there's been a global fear of death. Everybody has been psychologically affected by this to different degrees, but stress levels certainly have gone through the roof. And hopefully it's made us realize that actually, all these things we're doing are pointless if we are putting our lives at risk and our future generations at risk, where we can't even live in a happy, free, healthy society. What's the point? So hopefully this will be a wake-up call. I would finish with a quote that, one of my inspirations is Mahatma Gandhi, who was the man that really gave India independence from the Brits, and he did it through non-violent means. And one of his quotes, which I love, I used to put it on my Twitter feed, and I've changed it now, but which is, "It is health that is the real wealth, and not pieces of gold and silver."
It's a great message. That's a great message. People are understanding it. I even heard Elon Musk is trying to give away his possessions and that type of thing. So I think that's great. Anything else you're doing in the next week or two that?
No, just carrying on, Brian. To be honest, with with the advocacy work, I'm writing at the moment some stuff. I'm still doing consultations from home with patients. So just hoping that we can come out of this lockdown in a safe way as soon as possible. I like everybody, just wants to get back to some normality. I'm missing socializing with my friends. I'm missing going out to restaurants, going out on a Friday evening, with my buddy into the heart of Soho and into our kind of our equivalent of a Cheers bar. So I'm missing all of that stuff. I'm missing going to the gym. I mean, for me, my gym is my place of meditation and working out in the gym. I'm missing all of that. The people I hang out with in the gym and I speak to, we're social creatures. And I think that having that social disconnection, physical social disconnection, of course we've got all these other mechanisms and means where we can communicate through social media, but it's not the same as physically being or meeting people. Aristotle said, without friendship, no happiness is possible. So I think we need to get back to some level of normality where we can interact with each other, and hopefully then we'll all start to feel better as well.
I love that message. Let's do it. Where can people find you?
I'm on Twitter, Dr. Aseem Malhotra, Instagram, Lifestyle Medicine Doctor. I have a website, draseem.com. And Facebook. I post a lot of stuff on Facebook. So yeah, I'll just carry on, pumping out the message. Some other good news is the fact that this message did seem to go international. Australia picked up a new story on it, New Zealand. And on Tuesday, the Times of India, through their Instagram handle, is giving me a platform to speak for 10 to 20 minutes on what's wrong with the Indian diet. In India, there's a massive problem with type 2 diabetes. Premature death from heart disease is the highest in the world. So I'm using it as an opportunity really just to try and get some information and facts out there to the Indian population, whoever tunes in. We just keep hammering away, man. And hopefully we'll start to see a change and reversal in these epidemics of obesity and type 2 diabetes in the next few years, because we really have to. I don't think there's a choice now. I mean, I think everybody needs to
Hmm.
acknowledge this needs to be dealt with properly and can no longer be ignored.
That's so great. I'm really interested in this India on Twitter thing. What is your kind of general message? I know what my message would be, but what is your message to them?
Listen, I think the low-hanging fruit, Brian, is of course, there are people involved with these in the so-called diet wars, if you like, in
Hmm.
terms of what the optimal diet is. You've got obviously vegan, plant-based, you've got ketogenic, you've got I advocate for a Mediterranean low carb, low sugar. But I think one thing that hopefully everybody can agree on is that junk food, ultra-processed food, is the major issue right now in terms of our consumption. And if people were to really cut that out or minimize the consumption of it, which is 50% of the calories in the British diet now, and I'm sure it's similar, if not more, in the United States, and start eating more real nutritious food and cut out the snacking and make the treats minimal, that in itself will have a big impact on populations and on individuals very, very quickly. So I think I'm going to focus on that. In India in particular, there's a lack of knowledge, certainly about the harms of sugar. We have a lot of sugar in it. We're the largest producers of sugar in the world. There's a lot of sweet stuff in Indian food, in the culture. You go to the temple, people feed you sugary stuff. It's very much ingrained within the culture. So I think it's about educating to say, listen, it doesn't mean you can't have it, but you shouldn't be having it every day. And the refined carbohydrates in excess are a real issue. So I'm going to really talk about that and the snack foods, for example, and not obviously neglect the issue about being sedentary. I think that's something else. Indian people in particular, what a lot of people don't realize is that they tend to suffer from diet-related disease at much lower BMI. So, what's interesting is metabolic, being metabolically unhealthy affects about 21% of normal weight Caucasians, and then it increases amongst blacks, Filipinos, but Indian, South Asians in particular, 46% of normal weight, normal BMI between 18 and 25 are metabolically unhealthy. And it's due to insulin resistance and probably a combination of, which is diet and being sedentary, I'm sure. So that message also needs to permeate amongst Indians. A lot of them will have the illusion of protection or think that the reason they get hypertension or type 2 diabetes is purely genetics and nothing to do with what they're eating. And I think that message needs to change and needs to get out there. So that's what I'm going to be working on.
That's so great. Yeah, I've been talking a lot about this lately with some doctors, and yeah, how you can be thin on the outside but fat on the inside. It's a great message. And also, your message about processed foods and ultra processed foods is exactly what I would have said to India. So I'm glad we're on the same page. I try not to get into diet wars. I'm kind of just saying, hey, let's do whole foods. Let's not say animal foods are bad. Let's get rid of the highly processed foods, and we're good. I don't really care your ratio
Absolutely.
of plant to animal, whatever.
Sure. Sure. No, absolutely. I think that's a really important message, good message to start with. And of course, the science will be ongoing and more studies will go into the finer details about what dietary pattern may be slightly better for you than others. But I think the major issue affecting the world at the moment with obesity and type 2 diabetes is not low fat or keto or whatever. It's about the ultra processed foods.
All right. You heard it here. Thanks so much for checking in and take care.
Great. See you, man.
Okay.